Good morning, everyone, and good morning to our media partners and those who are joining us live on YouTube. Today, May 7, we are having this media forum, and here with us is Yusek Rosette Vergere to welcome us all. Yusek.
Good morning, everybody. Magandang umaga po sa inyo lahat. Thank you, Laura. Welcome to our Friday's Media Forum. So, ngayon po, nung nakaraang linggo, para po sa pag-obserba ng Road Safety Month, nakapanayam po natin si Mr. Robert C. ng movie Move as One Coalition upang isulong po ang tiyak na kaligtasan ng ating mga lansangan, lalong-lalo na po para sa mga gumagamit ng active transport. Nakasama din po natin si Dr. Solante, isang infectious disease expert, at kanyang tinalakay ang vaccine effectiveness at halaga po ng masusing pagsunod sa minimum public health standards even after getting vaccinated. Kaakibat ng ating pagtiyak ng tuloy-tuloy nating pagbangon bilang isang bansa, ang ating patuloy na paghatid ng dagdag na proteksyon ng bakuna sa COVID-19. Sa kasalukuyan po, nakakapaghatid na tayo ng higit sa 2 milyong doses ng mga bakuna sa ating mga priority groups A1, A2 at A3. Sa usapin naman po ng kaligtasan ng mga bakuna, muli na nating sisimulan ang paggamit ng bakuna ng AstraZeneca sa mga miyembro ng priority group na mas mababa sa 60 years old. Ang desisyong ito ay nagbunga sa pagpupulong po ng Department of Health, ng Food and Drug Administration, ng atin pong lahat na expert groups at ng Philippine College of Hematology and Transfusion Medicine Incorporation. Kaya nakakatiyak po tayong lahat na masusi po itong pinag-aralan at ito po ay base sa scientificong ebidensya. Bago po nakarating dito sa rekomendasyon na inaibigay po natin, inuulit po namin na ang lahat po ng ating mga policies at recommendations ay nakabatay sa best available scientific evidence at nakatuon po sa kaligtasan ng lahat ng ating mamamayan. Sa kabila po ng ating patuloy na pagbabakuna, patuloy pa din po ang pagkilos na palakasin at palawigin ang ating health system's capacity. Malinaw po sa ating lahat ang pagiging kritikal ng aspetong ito ng ating health system sa ating kabuuang pagtugon sa pandemya at patuloy na pagbibigay ng iba't ibang healthcare services. Tungo dito, as of May 5, 2021, meron na po tayong 33,493 dedicated COVID-19 beds sa buong bansa. And as of April 30, meron na po tayong 8,848 total healthcare workers na atin pong naidagdag sa ilalim ng ating emergency hiring program. At agad po natin sila naitalaga sa mga pasilidad na nangangailangan ng karagdagang healthcare workers. Kasabay po nito, patuloy pa rin ang pagtatatag ng mga bagong facilities upang tiyakin na meron po tayong kakayahang bigyan ng karampatang tulong at kalinga ang lahat po ng nangangailangan ng ganitong serbisyo. Ngayong araw po ay makakasama natin sila Mayor Rolen C. Paulino Jr. ng Olongapo City and Dr. Rosana Bukahan, Bataan Provincial Health Officer, upang marinig po natin ang mga hakbang na patuloy na ginagawa sa kanilang mga lungsod upang matiyak po ang kaligtasan ng kanilang mga komunidad. Naway maging inspirasyon po siya at ang kanyang Provincial Health Officer para po sa ating lahat, para po sa pagkakaisa, ang siyang susi po ng patuloy at ng kaligtasan ng ating mga lungsod at communities. So I will turn over the floor to Mayor Renj Paulino and the Provincial Health Officer of Bataan, Dr. Bukahan. Mayor.
Good morning po, Yusek, and everyone with us today, this morning. Magandang umaga po sa ating lahat.
ligtas ako, pamilya ko at kayo.
So, morning po. One of the things we did here in Olonga po, nakipag-tie up po kami dito po sa aming, may SM po kasi dito, SM Central. So, nag-partner po kami. And naging ginawa po naming vaccination site yung convention, yung SMX po, yung convention center dito. Kasi based on experience po, when we started with our vaccination, we noticed that during the assess po yung blood pressure nila because of the heat. So, in anticipation of the senior citizens to be vaccinated, initially po, dapat po para sa para po sa mga senior citizens lang yung paggamit po namin sa convention center. But sa ngayon po, we might continue using it until there are more vaccines po kami po. Pupunta na po kami sa mga barangay para po doon doon na po namin, of course, the day before, in-inform po namin yung mga babakunahan po, tinitext namin isa, yung mga lalo na po yung mga hindi nakakarating, quick substitute na lang po namin. We also text them. And then we follow the whole process po kami doon po sa encoding namin. We made our own vaccination record card na pinalagyan po namin ng QR code. So the idea here is para po at least kapag yung mga taga-Olonga po na nabakunahan na, meron po silang hawak na card. So kapag pumunta po sila sa ibang lugar, pwede pong ipascan lang po yung card, and then kahit po nasa ibang lugar sila, pwede pong i-verify ng ibang locality kung totoo ba po na yung person na nagpe-present po na as vaccinated ay totoong nabakunahan po talaga. So ngayon po nasa po kami, A2 and A3 din po kami. Most of the medical frontliners have been given the second dose, although definitely po hindi pa po namin nako-complete lahat. And ayun lang po, sana po we get more vaccines para mas mapabilis pa po namin yung rollout po. But I know po it's a national concern po, hindi lang naman po sa amin.
Thank you, Mayor Lenz. Actually, it's a global concern. Vaccine supplies, no? Hindi lang sa ating Pilipinas. So with that, we move on to our PHO from Bataan, si Ma'am Rosana Bukahan, before we open the floor for Mayor Lenz and Ma'am Rosana. Ma'am Rosana.
Permission to share screen po.
Go ahead, ma'am.
Yan, okay na po. Thank you. Good morning, everybody. This is the province of Bataan's local health system in response to COVID-19 pandemic. Our governor is very thankful for always inviting Bataan in every DOH endeavor. This is our demographics. Bataan is a first income class province with a total population 2021 projected of 849,474. We have 11 municipalities and 1 city with 237 barangays, 19 RHUs, 213 barangay health stations. We have 7 government hospitals and 8 private hospitals with a level 3 Apex Hospital, which is the BJHMC. We have 2 RT-PCR laboratories, one in BJHMC and in Mariveles District Hospital. And we have 16 treatment testing and monitoring facilities, or TTMFs, one of which is our mega quarantine and isolation facility located in the municipality of Orani. So this is the COVID situation in our province. This is as of May 5, 2021. As you can see in the screen po, as of May 5, 2021, we have a total of 6,278 confirmed cases, where these are the reported cases by the province, and 1,020 are active cases, and 52% of the total cases are linked to known COVID-19 confirmed cases, and majority of them are close contacts, while the remaining 48% are mostly APORs, OFWs, and healthcare workers who were exposed during their travels and in the workplaces. Also, we have a recorded outbreak last April 4 in our district jail, or the BJMP, recorded clustering of cases last April 4 nga po, and out of 464 persons deprived of liberty, 234 were tested and 134 turned out to be positive. And as to date, 99% of the cases were already recovered. There were 197 recorded deaths, and resulting to 3.14 of our case fatality rate. A total of 58,517 individuals were already tested, and 52,088 of them tested negative. We have highest reported deaths belong to more than 70 years of age, and most of deaths were due to comorbidities, hypertension, diabetes, bronchial asthma, and chronic kidney disease. The deaths were higher among males, 65%, and females, 35%. This is the sample tested by our BJHMC molecular laboratory. So this is the cumulative sample, and the tested refers to the number of specimens tested in total from the start of the laboratory operations to the current report date. As of May 4, 2021, 97,785 tests were already conducted by our BJHMC molecular laboratory, and some of the tests are reruns, repeat tests, and others. The daily positivity rate shows increase last month of March 2021 that ranges from 10% to 15%. For April 2021, there is a surge in cases that the province recorded daily positivity rate that ranges from 10% to around 38% of its highest peak, which was recorded last April 4, 2021. So the province of Bataan have organized 251 contact tracing teams since the start of pandemic last year, and composed of 2,740 trained and functional contact tracers and personnel. We have a ratio of 1:15 confirmed cases to close contact ratio. A total of 10.73% of positivity rate for 58,517 confirmed cases. Ito pong 58,570, dito po yung unique individual ng province of Bataan na na-test. Currently, we have 16 functional TTMFs with a total of 900 total bed capacity, and 38% bed occupancy as of May 4, 2021. Our hospital-based admitting capacity, our BJHMC, which is our COVID-19 referral hospital, has 37 ICU beds with a 95% occupancy rate, 73 isolation beds with 84% occupancy, and 53 ward beds with 100% occupancy. This is, again, as of May 4, 2021. This is our COVID-19 vaccination updates. So our vaccine tally as of May 5, 2021, the total vaccinated individuals for the first dose is 14,320, and for the second dose is 1,630. The total number of CoronaVac delivered to our province is 18,480 single dose per vial, and for AstraZeneca delivered to the province is 569, which is equivalent to 10 dose per vial. And most of the AEFI for these vaccines, for Sinovac, we have recorded 43, and for AstraZeneca, we have recorded 217. And all of these AFIs are 100% recovered. Most of the AFI recorded are hypertension, pain on the injection site, body malaise, and weakness. But again, the status, all of them are 100% recovered. We have also our cold chain management. The province of Bataan made sure that we are ready to accept any type of vaccine. So from -70 to +2 to +8 vaccine reps, ni-ready po namin yan. And we are monitoring it 24/7. We ensure the monitoring of our cold chain, that it is round the clock, and there is an assigned personnel monitoring our cold chain so that it could be managed well. And we strictly follow the priority list for COVID vaccination. We are now into A2. So A1, A1.1 to A1.7, na-cater na po namin sila. Now we are into A2, or yung aming pong mga senior citizens. So let's watch this very short video to show to you how we conduct or the process of vaccination in our province.
Mga proseso sa araw ng pagbabakuna. Una, ipascan ang QR code at sumailalim sa pagsusuri o health screening upang matukoy kung maaari nang tumanggap ng bakuna o kailangang ipagpaliban muna. Pangalawa, makinig sa mga gabay tungkol sa mga dapat malaman sa bakuna at pumirma ng final consent form pagkatapos nito. Pangatlo, magtungo sa itinalagang lugar para sa vaccination proper kung saan kayo tuturukan ng bakuna ng isang healthcare worker. Manatili sa inoculation center ng may 30 minuto o higit pa upang maobserbahan kung magkakaroon kayo ng side effects mula sa bakunang tinanggap.
And this is one of post-vaccination strategies to ease the waiting time for those who are vaccinated. LEDs were provided in the center for infomercials and COVID vaccination updates and entertainment. Pagdating dun sa mga senior citizen, kasi mainipin sila, most of them gusto nila umuwi na pagkabakuna. So ang ginagawa po namin, pinapanood namin sila ng mga movies. Nagre-request sila ng mga movies like yung mga movies po nila Fernando Poe Jr., nila Dolphy. So we made sure na na-entertain sila para matapos po yung time ng kanilang post-vaccination monitoring. And next would be, ito po yung COVID vaccination sites in the municipal level. So we have one centralized at the provincial level, and kinascade po namin ito down to the municipal level. For now, we have a total of vaccination site in the province. Nasa 6 na po sila. Ito po yung Balanga City vaccination site, Dalimay Municipality vaccination site, the Orion Municipality vaccination site, the Mariveles Municipality Vaccination Site and the Dinalupihan Municipality Vaccination Site. So that yung mga constituents po nila ay hindi na po lalayo. Pero we are maintaining our centralized facility para din mabigyan ng services naman yung iba na hindi po nakikater ng kanilang municipality. And this is the Bataan Pandemic Response Strategy. We stand to the prevent, detect, isolate, test, and treat strategy ng province. Ever since yung pandemic nagsimula, ginawa na po namin itong strategy na ito. So we have intensified the non-pharmaceutical intervention, messaging, or the improved risk communication. We have crafted provincial policies through our IATF, then now task force, resolutions on the implementation of minimum public health standards in place po yan sa aming province, and also strict implementation of non-pharmaceutical interventions, whether personal, community, and environmental, and strict border control measures, especially at the barangay level, kasi we believe na malaki ang participation ng barangay when it comes to the border control. And also, we have strengthen our risk communication and community engagement. The province bolstered its risk communication strategy to foster community awareness and involvement by enhancing its online presence through its official website and maintaining its widely accessed social media accounts of our provincial governor and One Bataan, where updates on the cases of COVID and public advisories are regularly posted. The province has also endeavored to increase the community participation by updating its incentive program. We called it the One Bataan Seal of Healthy Barangay. We converted it during pandemic to One Bataan Seal of COVID-free Barangay. Now, One Bataan Seal of COVID-free and dengue-free Barangay. It was developed to encourage innovation from barangay leaders to achieve COVID-free barangay status by rewarding those that achieve 20% decrease or more in cases every 15-day period with 25,000 pesos cash incentive for each barangay. For the detect or strategy under the PDITR, we have strengthened our contact tracing. We have strong local chief executive support to monitor the contact tracing performance of each municipality. We have rapid and quick approach to case and contacts. We have localized our granular lockdowns to facilitate contact tracing. We have also deployed the contact tracing teams to different LGUs. We have digital-based contact tracing in place po yan sa aming province, and we have strong interagency collaboration. And for the isolate and quarantine strategy, we have 16 functional TTMFs as of May 5, 2021. Hotels, schools, library, and people center. We also established them as quarantine facilities, especially during the first part of pandemic. And now we have this Mega Bataan Processing and Quarantine Facility, which caters majority of our asymptomatic and mild cases in the province. For the test strategy, we have, as I've mentioned before, we have One Bataan BJHMC RT-PCR COVID testing facility with Gene Expert, and now the newly established Mariveles District Hospital RT-PCR. We still have existing MOA with the Philippine National Red Cross, and we expanded testing to our health workers and frontliners, those high-risk close contacts and OFWs. We have trained swabbers and laboratory personnel for RT-PCR testing, both at the provincial and municipal level. And the PHO is playing the role as the remote swabbers kapag nagkaroon ng outbreaks or clustering of cases in anywhere in the province of Bataan. We have available vehicles to transport specimens to COVID-19 laboratories, and we have sufficient supply of PPEs and testing swabs for our swabbers. And for the treat strategy, we have long activated the PHO the DOH, and the One Bataan Command Center hotline for the referral of our cases. We have also increased our health system capacity. For bed wards, before we have 4, now it's 35. For ICU beds, before we have 7, now it's 24. And for the mechanical beds, before it's 4, now it's 35. We have also continuous non-COVID health service delivery para hindi naman po maiwan yung ibang program na ng aming public health. And we opened our BJHMC annex to cater to the non-COVID patients, since BJHMC as our Apex hospital was the dedicated hospital for our COVID severe and critical. And also we have strengthened our district hospitals, and we have an existing MOA with all private hospitals for the accommodation of our non-COVID patients. These are our breakthroughs for the province. We have our provincial COVID-19 vaccination plan or micro plan, and in every municipality, meron din po sila nito. We have smooth implementation of the micro plan. The vaccination rollout is centralized, and then we have also from different municipalities. We have this One Bataan Seal of COVID-free and dengue-free barangay for the leveraging ng aming mga programs. We have these 24/7 COVID updates and vaccination updates. Meron pong dashboard na ginagamit ang province of Bataan. Napopost po ito every day. Dito nyo po makikita yung COVID update namin. 24/7 po ito. At kasama dyan yung aming mga TTMFs, yung lahat ng mga data na kailangan nyo po for COVID. Nakapost po yan every day at gumagalaw po yan 24/7. Ina-update din po namin yan. We have functional epidemiology and surveillance units and also SDN referral. Yung ESO po namin from the provincial down to the municipal and to the lahat ng aming mga hospital epidemiology and surveillance units, they are all functional, even the private ESOs. We have strong coordination, collaboration from the province down to the municipalities, down to the barangays. And as I mentioned, we have 2 molecular laboratories. So this is our ways forward. We are establishing now the One Bataan Hospital Command, or the Unified Comprehensive and Coordinated Response in the COVID-19 pandemic, with recognizing its roles and functions as health facility coordination and referral, for the coordination for medical transport and pickup, health systems capacity data analytics and risk communications, and the engagements of our stakeholders, both from government and private sector, ensuring the adequate critical care services to hospitals. So yan po yung masashare namin for the province of Bataan when it comes to the COVID response and vaccination activity. That would be all po. Thank you very much again from the province of Bataan and from our governor. Thank you to DOH for always recognizing the participation of our province.
Thank you, Dr. Rosana Bukahan. Now, we are going to accommodate some few questions po, from our media partners. So from Red Mendoza, a question to Mayor Lenj and Dr. Bukahan. How ready is Olonga po and Bataan sa ibang mga bakuna with lower temperature requirements? Handa na ba ang mga storage facilities po ninyo, or do you need assistance po from national government? Mayor Lenj?
Kami po sa Olonga po, actually we've spoken with, us as yung sa League of Cities po. Ang direction naman daw po ng national when it comes to the vaccines is yung mga may capacity, yung mga may capacity po for the more sensitive vaccines, ibibigay po doon sa mga localities na meron. Sa amin naman po, at this stage, we'd rather have those that do not require the lower temperature storage. Although kaya naman po namin, pero smaller volume lang po yung masa-store namin dito. So mas prefer po namin yung mga hindi po kailangan ng sobrang babang temperature.
Thank you, Mayor Lenj. Dr.
Yes po, as I've shown kanina po doon sa presentation, ni-ready na po ng province namin yung mga vaccine reps namin. So, ready po kami kahit na anong bakuna po yung dumating sa province. Naghanda kami ng yung -70, -20, +2 to +8. Yung nakita niyo po sa presentation kanina, medyo kulang pa po yung pictures na yon. But in reality, we have lahat ng vaccine reps na kakailanganin po. But for now, AstraZeneca and Sinovac po yung tinatanggap ng province for now. Thank you po.
Okay po. Last 2 questions, sabayan ko na po, no? So, kailan daw po kayo magsisimula ng pagbabakuna sa mga may comorbids at how do you address vaccine hesitancy po sa inyong mga kababayan? And naging choosy daw po ba sila sa bakuna? Here, Lange, maybe we begin with you.
Yep. Opo. So as to the timing for the vaccination of those with comorbidities, lang po, sumusunod po kami sa alam ko po ngayon pinagsasabay na rin po yung mga senior and yung may comorbidities. Yun nga lang po, sa amin po yung namin, as soon as bibigyan po kami ng vaccine, binababa po agad namin, din-distribute naman namin agad. Sa ground po talaga, nung nag-start po yung rollout po, ang taas po talaga ng hesitancy ngayon. So kami po paliwanag po namin sa taong bayan. Tapos po sinasagot din po namin yung mga questions nila. Ako po personally, pinuntahan ko po nung as early as March po ng mga barangay assembly, pinuntahan ko po talaga. Talagang dinidiin po namin sa taong bayan na importante po yung pagbabakuna at ito lang po talaga yung way out natin dito sa pandemic. Pero naman po, maganda rin naman po kasi na nakakausap po yung taong bayan at may mga questions po sila, and sa experience ko po, as soon as napaliwanagan po sila, naman po, may napapaliwanagan naman po, gumaganda naman po yung view nila, yung perception po nila sa bakuna. Hina-highlight po namin na yung mga frontliners po natin, yung mga leaders po ng community, talagang gusto po magpabakuna at okay naman po, safe naman po yung bakuna. Ako po, last week lang po, nakuha ko po yung first dose ko. So talagang as much as possible, pinablicize po namin na ako mismo po, kung ano po yung available na bakuna, yun po yung kinuha ko, yun po yung binigay sa akin, para makita rin po nila na po talaga, all vaccines are safe and all vaccines are effective.
Thank you, Mayor. Dr. Yabukahan.
Thank you.
Yan. So yung province po namin, meron kaming risk communication strategy talaga. So we are preparing nga po dito sa vaccination since honestly since December pa of last year. So we have crafted our microplan thoroughly at in-ensure namin na masusunod po kung ano yung nasa microplan. And isa doon sa microplan yung enlistment po nung ating population. Sino yung mga eligible population from A1, A2, A3. Now, nagsa-start na po kaming mag-enlist ng mga A3 hanggang A4. Kasi ang Bataan po kasi meron din kaming ginagamit na app, yung sa app case. So, we named it Bataan Vax. So, hindi po kami nahihirapan kasi meron nga kaming gantong registration. So, ito yung prepare namin talaga kasi na-foresee na po namin ito na magkakaroon tayo ng malaking problema when it comes to the enlistment of the eligible population. So hinanda po namin ito. Tapos yung sa risk communication strategy namin, meron po kaming online presence through yung official website po ng aming provincial government, at tinutukan namin kasi nga yung demand generation, yun yung concern namin kailangang gustuhin nilang magpabakuna. At dahil sinunod namin strictly yung sinabi ni DOH na prioritization, na ipaliwanag po namin mabuti yan sa mga tao, at inuna namin yung mga health frontliners. At nakakatuwa kasi even the private hospitals, yung mga private clinics natin, yung mga stand-alone clinics natin, katulong namin sila sa pag-explain na maganda ang bakuna. Whatever vaccine is in your hands, that is the best vaccine. So ganyan yung mga strategy na kinonvey po namin sa mga tao. And nakakatuwa kasi during vaccination, even yung ibang mga hindi kasama dun sa priority, sometimes nagpapalusot sila na baka pwedeng mabakunahan na rin sila. So doon namin na-realize na ang ganda pala nung naging risk communication namin sa mga tao, kasi hindi sila hesitant magpabakuna. Sa totoo po, ang mga taga-Bataan ay hindi hesitant magpabakuna. They are very willing na mavaccinate na, even hindi pa sila yung group. So doon kami medyo nahihirapan, hindi pa po new time. Ngayon po ay A1 pa, mga frontliners pa, o A2 pa, mga senior citizens. Kayo ay may comorbidity, sa next pa po kayo. Huwag kayong mag-alala kasi hinahanda na namin yung inyong enlistment, yung inyong registration for A3. Tapos yung A4, dadating din po tayo dyan. Ganun na po yung level ng aming communication sa kanila. Kasi yung demand generation po talagang yun ang pinaigting namin. So hindi po sila hindi sila hesitant na tumanggap ng vaccine. And hindi ko lang masyadong napakita dun sa mga pictures, even yung mga senior citizen namin na mga nangaka-wheelchair, na yung iba may mga tubo pa nga, pero they are very willing to be vaccinated. Nagpupunta sila dun sa aming centralized vaccination site. So yun po yung isang naging parang best practice namin for the province, na strengthen po namin yung aming risk communication and yung aming strategy para dun sa demand generation for the vaccination. Salamat po.
Thank you, Dr. Rosana. So it's not vaccine hesitancy anymore, it's vaccine eagerness. Along that context, I'll ask the question to Caroline Bongkin. Tuloy-tuloy po ba ang vaccination sa inyo, and ilang days na po ba kung nagkukulang man ang vaccine supply ninyo? Maybe Dr. Rosana, you can go ahead first.
Yes po, tuloy po yung pagbabakuna. Since March po kami nag-start. Yung pinakita ko po kanina sa screen yung vaccine tally. Kung ilan po yung nabigay sa amin na ibabakuna po namin yan kaagad. Hihinto lang po kami kapag wala na po kaming bakuna. Actually, nagre-request pa po sana kami ng more bakuna. Kaya lang, naiintindihan naman po namin yan kasi doon sa Central Luzon, lagi pong sinasabi naman ni RD na ito yung dumating na bakuna for Central Luzon, ito yung allocation. For example, si Bulacan, nasa bubble siya, so mas more yung tatanggapin ni Bulacan. Naiintindihan naman po namin yan. But then again, we are very willing to accept vaccines po kasi unang-una naka-ready po kami, at kapag hindi po kami nagbabakuna, hinahanap po ng tao bakit hindi kami nagbabakuna. And at present, 6 po yung naka-ready namin na vaccination sites. 5 municipalities and 1 centralized vaccination site. At magsa-start na rin po within the week or next week yung iba pa po naming municipalities na nagre-ready at bumibili pa po ng iba nilang mga kailangan for the vaccination site. But then again, yung lahat po nung nakukuha po naming allocation sa region, na-allocate po namin kaagad dyan into different municipalities. At binibase po namin yan doon sa enlistment na isinabit po through microplan nung aming 11 municipalities and 1 city. Thank you.
Thank you, Dr. Rosana. Kayo po, Mayor Lance, gusto po ang vaccine supply sa inyo?
Opo, actually pareho po kami ng Bataan. On our end po tuloy-tuloy rin po yung vaccination namin mula po nung nag-start yung rollout. Basta lang po kami, very simple lang po. Basta po may vaccine po kaming nakuha, right away po ni-roll out po agad namin, didistribute po agad namin. And yun nga po, ang maganda po, marami na po talaga na gusto po magpabakuna ngayon. And actually mas mataas po yung demand kaysa sa supply at this stage. So kami po like what Bataan said, po kami, very much willing po kami to accept more vaccines, kaya pa po namin, but also we understand the situation. Basta po kami, kami po ang ginagawa po namin, basta pagkakuha po namin ng mga vaccines right away po, inubos po agad namin. So, yun po, nauubusan din po minsan na, but okay lang po, naintindihan po namin.
Maraming salamat po. Para kay Yusek Vergere mula kay Greg Gregorio of TV5, ano pong take ng DOH now that LGUs are preparing for storage requirements, and does it make it easier for the rollout of the vaccination program? And maybe some few words, Yusek, sa presentation ni Mayor Lange at ni Dr. Bukahan. Yusek.
Yes. Thank you, Laura. First, of course, kapag ang mga local governments natin ay proactive at nagkakaroon na ng sarili-sarili nilang storage facilities, that is really something of a big help for the national government. At kami po ay nagpapasalamat ng marami sa ating mga local governments na nagkakaroon po ng mga ganitong efforts, because it takes away a lot ng trabaho dito po sa national government. And unang-una, resources-wise, malaking bagay din po sa amin dahil ang national government, as you all know, we are really trying to finance all of these activities, requirements for the vaccine deployment program. And if local governments can help, that would be of much help for the national government. So we laud all of the local governments having their own storage facilities, having their best practices, katulad po ng pinakita ni Mayor Lange at saka ni Dr. Bukahan from Bataan. Napakaganda po ng efforts nila. If you would see yung kila Mayor Lange, they have partnered with a private sector unit, no, katulad ng Shoemart, para magkaroon po sila ng malawakang spasyo para sa pagbabakuna. At iyan po ang ating gustong direksyon ngayon. Ayaw po natin ng mga masisikip na lugar sa mga pagbabakuna dahil baka magkasakit din po ang ating mga kababayan. Pangalawa, ang objective po ngayon ng national government kasama ang local governments is to speed up and to scale up vaccination. Gusto natin the soonest possible time mabakunahan po natin ang ating mga kababayan. So nagpapasalamat po kami kay Mayor Lange and of course sa atin pong PHO ng Bataan, si Dr. Bukahan, napaka comprehensive nung kanyang ipinakita sa atin, kompleto PDI-TR response nila at nakikita ho natin how they take care of their constituents. And for that, we thank the province of Bataan, their governor, and of course, our provincial health officer. Suki na po namin si Doktora sa aming mga pag-uusap, no? Dahil gusto natin i-highlight talaga yung magagandang practices ng ating mga local governments. So maraming salamat po, Mayor Lange, Dr. Bukahan, at sana po sa uulitin, maimbita po namin po kayo uli dito.
Salamat po.
For you, Sec. Thank you po. Stay safe po.
Kayo rin po. Salamat po.
Salamat po.
Thank you, Mayor Lange, and thank you, Dr. Bukahan. Now we move on to the regular media forum. First question, Yusek, from Caroline Bunkin. Pwede po bang malaman kung ilan ang total oxygen supply in NCR, loss area, and ilan ang ginagamit at ilan pang available? Yusek.
Yes, thank you. Caroline, nagkaroon kami ng survey among all of the hospitals, no? Because we would want that we are ready kung sakali for this kind of requirement ng ating mga pasyente. So among our 1,221 hospitals that we were able to get data from, 3 or 0.25% reported shortage at least once daily. 15 or 1% reported shortage at least once weekly. 63 or 5% reported shortage at least once monthly. And 77.75% or 943 reported no shortage in any time of the week or any day. Among the infirmaries naman, ang sa mga nag-submit ng data, 546 sila, 2 or 0.37% reported shortage at least once daily, 19 or 3.48% at least once weekly, and 54 or 9.89 at least once monthly, and 364 or 66% reported never had any shortages at all. So ngayon, yung consumption po nakuha rin natin, and we are consuming about 14,000 tanks per day nationwide. And specifically for NCR, we are consuming 5,300. So all of these data from this survey, we have forwarded to the Department of Trade and Industry. Sa katunayan, kahapon po sa IATF, nag-present na po sila, nakausap na po nila yung 3 malalaking gawaan o nag-generate ng oxygen para sa ating mga ospital dito sa Pilipinas. Meron po sa Cebu, meron po sa Calamba, at meron po dito sa Taguig. So nakausap po nila lahat yan, and meron pong pag-uusap na on how we can generate more oxygen so that we can be ready and we can prepare our health system if in case, and hopefully not, na magkaroon po tayo ng mas mataas na pangangailangan para sa oxygen supply.
So, Hospital USEC, sapat po ba ang oxygen supply sa bansa ngayon?
Base sa numerong ibigay ko sa inyo, it is enough, it is sufficient sa ngayon, sa current number din ng mga kaso natin. Nagkaroon din tayo ng parang forecasting kung ilan ang kakailanganin natin kung magdodobli nga itong mga pangangailangan sa kasakaling tumaas ang mga kasong mangangailangan ng oxygen. And based from our data, ito pong ating current supplies, kung madodobli po per month, no, ang ating mga kaso, ay sufficient pa ang ating mga needs for oxygen. But at the same time, ayaw pa rin pong magkaroon ng complacency ng ating gobyerno. Kaya nga sabi ko sa inyo, ang Department of Trade and Industry ay talagang kinakausap na po ang mga nagpo-produce ng ating mga oxygen dito sa ating bansa so that we can have more.
Thank you po, Yusek. Next question is from Aiko Miguel of UNTV. Sec Harry Roque said President Duterte will still have his second dose of Sinopharm's COVID-19 vaccine. If the president experiences any adverse events following immunization, especially if it's serious, who will be liable to it, and how are we monitoring the president's condition after his first jab?
Of course, he's the president, no? So we will monitor him every day about regarding these adverse events, no? So meron ho tayong monitoring dyan. He has to be taken care of also by the Department of Health. Kung pag-uusapan po ang liability, it is a compassionate special permit, and based from the compassionate special permit conditions na klaro naman po iyon sa mga nag-apply nito, yun pong ospital o kaya yung doktor na nag-apply nitong compassionate special permit is accountable.
Thank you, Yusek. We have several beat reporters who ask the same questions on mixing of brands. So I'll ask the question po, no? FDA DG Eric Domingo said in Laging Handa that the DOH is now crafting the guidelines on the possible mixing or interchangeability of vaccines. Ano po ang magiging scope nito? And may mga preliminary discussions na po ba? And when does the DOH expect to release the memo circular regarding the mixing of vaccines?
Yes, no? So ito pong sinabi ni Yusek Eric, tama naman po, pinag-uusapan na natin at saka pinag-aaralan. Ito pong mixing of brands. And sa katunayan, last night we had a meeting with the Department of Science and Technology regarding this matter. So ang pag-uusap po natin, tinignan po, may mga ebidensya na tinitignan, scientific evidence at that. The vaccine expert panel was there also in that meeting kung saan nagpakita po sila ng mga datos. And base po dun sa pag-uusap na yon, napag-alaman natin that there is just one country for now which is trying, no, doing a trial on this mixing of vaccines. So titignan po natin yung experience ng ibang bansa ukol dito, kung ano man po ang maipublish nila based on the results of their study, para maisama po sa mga pinag-aaralan. So tayo rin po magkakaroon ng ganitong pag-aaral para kung sakali magkakaroon tayo ng kasagutan dito sa question na to if we can really mix vaccines. So pag-aaralan pa ho, and we will give you information in the coming days. Sa ngayon, ang masasabi lang ho natin, ang atin pong mga eksperto, no, ay kumakalap ng mga tama at na impormasyon, and they're saying there is theoretical basis. But that is still theoretical. Kaya nga po kailangan pag-aralan pa ng mas malawig para malaman po natin if really it is going to be acceptable and it's going to be safe and it's going to be efficacious for our citizens.
Thank you, Yusek. So, balikan ko lang, no, Yusek. Although sinabi niyo po na sapat naman yung oxygen supply. So, sinabi daw po kasi, no, na wala na raw pong makuhang supply yung ibang nagtitinda ng oxygen 1 month nang walang dumadating. how are we going to ensure na may supply pa ang ospital sa mga susunod na linggo?
Base dun sa aming pakikipag-usap sa kanila, especially here in Metro Manila, wala po kaming nakuha na ganyang datos. Kung sakasakali pong may mga ospital na nagkakaroon ng ganitong mga issue, they can send it to us so that we can be able to facilitate at matulungan po natin yung ospital na yan para makakuha po ng mga supply na kinakailangan nila. Base rin po sa ating pakikipagpanayam nga sa Department of Trade and Industry, they are now really closing in with these negotiations with the oxygen manufacturers para nga po ma-increase pa yung supply dito sa ating bansa. So please, kung ano man pong facility yan, please let DOH know so that we can help you.
Thank you, Yusek. From Aiko Miguel of UNTV, will the DOH recommend Sinovac instead? What is the DOH stand on the use of 2 different brands of COVID-19 vaccine? And I'll ask na rin po yung tanong ni Leigh Alves kung may mga bansa na bang nagtatrial ng vaccine mix.
Katulad ng sabi ko kanina, Leigh, may isa na ayon dun sa pagmamapa ng Department of Science and Technology, which is also already doing this study or trial about mixing of vaccines. Aside from that, wala po silang sinabi na iba pa. No? That's just one. It's from the UK. Sila po yung sumusubok ng ganito sa ngayon. And malalaman po natin in the coming weeks kung ano yung magiging resulta ng kanilang pag-aaral. Yung mixing of different brands sa ngayon ng ating protocol, single brand muna po tayo. So kung pag binigyan tayo ng Sinovac sa umpisa, Sinovac pa rin ang ating second dose kasi wala pa po tayong sufficient scientific evidence to state that we can already mix brands. Katulad ng sabi ko, pag-aaralan pa po natin at katulong natin ang Department of Science and Technology at saka ang ating vaccine expert panel sa pagsasagawa nito. Will DOH recommend Sinovac instead? Ano ba ito? Para saan to, Laura?
I think Yusek in the context of PRRD receiving Sinopharm. So will you recommend Sinovac as the second dose?
Katulad ng sinabi ko po, wala pa ho tayong sufficient evidence, so we cannot give that recommendation to anybody, no? Hindi po sa presidente at kahit na kanino. Kapag nakakuha na ho tayo ng sapat na ebidensya based on science, our experts have recommended, and that's the time that we were going to say that we can recommend this mixing and matching of vaccines.
Thanks, Yusek. From Leigh Alves of GMA News. So sa 149 na pasaherong dumating mula India mula April 1 hanggang 30, ilan na lang po ang naka-quarantine and saan po yung location ng 5 nagpositibo at kailan sila dumating sa bansa? May resulta na rin po ba yung ginawang sequencing sa kanila?
Okay, uunahin ko lang yung pinakahuling tanong, no? Pag nag-genome sequence tayo, we can't get it overnight. Kailangan po ng 1 linggo, no? Although ngayon nagsi-separate run ang Philippine Genome Center ng mas maliliit na makina para mas mabilis, maybe in 2 to 3 days maaari tayong makakuha ng mga resulta kapag ganito. Pero mas maliit po yung batch ng samples kapag mas maliliit ang makina. So ngayon po, as of May 6, the Bureau of Quarantine was able to share already a partial list of 155 passengers with travel history to India for the month of April. So that is April 1 to April 30. So among these arrivals, 135 were Filipinos, 15 were Indian nationals, 3 were British, and 1 American and 1 Sri Lankan national. 5 cases tested positive with RT-PCR on the 4th to their 7th day after arrival. So it's a range kasi iba-ibang araw na kuwanan. 148 were negative and 2 test results are still being verified. So among the positive cases, 4 po ang Pilipino, 1 po ay Indian national. Their arrival dates range from April 1 to 18. 2 po dun sa kaso na nagpositibo flew in from Dubai. 2 po ay flew in from Doha and 1 flew from Singapore. So we are in the process of retrieving the samples of these 5 positive travelers so that we can subject them to the Philippine genome for the whole genome sequencing. And also we are still trying to verify and complete the details of these 155 passengers, including the manifesto ng 5 pasahero at yung kanilang flights na sinakyan. Laura?
Salamat po, Yusek. From Leigh, Pinag-aaralan bang isama sa travel ban ang mga bansang may detected na rin ng variant first detected in India, gaya ng Singapore?
Napag-usapan niya, no, Lay, dun sa aming mga pag-uusap with the IATF officials as well as with the Secretary of Health. And tinignan po natin itong 18 bansa na meron na ngayong na-detect na Indian variant. At nakita ho natin that in some of the countries, pa isa-isa, pa dalawa-dalawa, pa tatlo-tatlo. So parang because of this kind of spread, no, this Indian variant, gusto natin makasiguro. That's why we are doing tighter border controls. But the decision was, let's confine first the restriction dito po sa mga bansang sa tingin natin malaki na ang probabilidad na mataas na rin itong variant na ito sa kanilang lugar. And you saw in the news yesterday na yun pong Nepal ay tumataas na rin po ang mga kaso. And maybe the assumption would be it's because of this Indian variant. So as to the other countries na hindi nakasama sa restriction, we are implementing a strict border control wherein we have to ensure the 14 days quarantine. Na-aprobahan na po sa IATF kahapon, ito pong ating rekomenda na magkaroon na ng 7th day testing, no testing upon arrival, 7th day po ang testing, and completed 10-day quarantine here at the national level. I-endorse sa local government after the 10th day, and yung 4 days dapat siguraduhin din ng local government na matatapos ng ating mga travelers. So this is a process na para ma-ensure natin that even though nakakapasok pa rin ng mga ibang travelers, especially Filipino sa ating bansa, nasisiguro po natin na naka-quarantine natin sila na maayos o na-isolate natin sila maayos to break the chain of transmission.
Salamat, Yusek. So what do we know so far about the B.1.617 variant that was classified by the WHO as a variant of interest?
The B.1617 was first detected in India last October of 2020. Ito po ay nakita dun sa tinatawag nating database, yung GSAID. It has also been identified in UK and the US in February of 2021. At sa ngayon pala, 21 countries na ang meron nitong variant, hindi pala 18 na lang. So the WHO International Health Regulation do not have any consolidation of country reports. So since hindi pa naman siya required para i-report officially, kasi hindi pa siya yung variant of concern. So the B.1.617 genome has at least 15 mutations, with 2 specific mutations in the spike protein, which defines it. So these 2 mutations explain why it's being called a double variant. But this is a misnomer, sabi nga nila, kasi marami pa ring mutations ang makikita sa isang variant. So kaya nga sabi natin yung double variant mukhang hindi appropriate. But anyway, the 2 mutations of the B.1.617 in the spike region are L452R and the E484Q. The L452R mutation is present in the dominant strain found in California. Ang natagpuan sa California is B.1.429, while the E484Q is deemed similar to the E4848K mutation found in the South African variant and the P.1 first reported in South Africa and Brazil. So yung mutation po ng L452 mutation, associated siya sa increased transmissibility and reduced antibody neutralization. And the E484Q mutation increases the binding capacity of the ACE2 receptor, which may help the virus escape immune response. So marami pa rin hong pinag-aaralan tungkol dito sa variant na ito. Ito po yung mga paunang na-discovery na dito sa variant na to. And until this date, no, as we talk right now, it is still a variant under investigation.
Salamat po, Yusek. Ano na po ba ang ginagawa ng DOH para matukoy kung dominant variants na ang variants first detected in UK and variant first detected in South Africa sa bansa o sa ilang lugar gaya ng NCR at Region 4A?
Actually, that's not the objective, no? Let me just clarify. Kaya po tayo nag-whole genome sequencing is not to determine what dominant variant we have here. but we would want to see specific areas which are having clusters of infection, and we would like to determine the factors why. And this might be because of the variants, and this might be because of other factors. But basically, the objective of whole genome sequencing, kahit saan pong bansa, hindi kaya na i-genome sequence lahat, no? So kaya po ang ating ginagawa lagi purposive sampling. And purposive sampling so that we can be able to ascertain or determine bakit ba nagka-cluster doon sa lugar na yon. Bakit ba biglang taas ang mga kaso doon sa lugar na yon? It might not be to answer if it's the dominant strain or not. This can be done, pero longer period of time is needed and a full study is needed so that we can be able to have this kind of response, no, to that question. But primarily, ang ating ngayong rason or objective kung bakit tayo nag-whole genome sequence is to aid in our surveillance so that we can focus more on areas with specific clustering of infections and maybe because of these variants that we have identified.
Thank you, Sec, for clarifying the objective of whole genome sequencing. From Van Villegas of Business World, Yusek Virgeri on Wednesday said that there is an increase in the number of calls received by the National Center for Mental Health on its hotline for mental health concerns. Can we get the latest data on this po, and what were the reasons seen behind the increase?
Okay, last month, the number of calls sa NCMH crisis hotline received an average of 60 calls per day. And this totaled to 1,805 calls. So if we compare it with the previous months from the start of the year, January, in January, we have 1,089 calls. In February, we had 1,126 calls. In March, we had 1,604 calls. And in April, we had a total of 1,805 calls. So pag tinignan po natin, tumaas po ang mga tumatawag sa ating hotline. Majority of the calls received, 31% actually, is about anxiety and depressive symptoms. Yun pong 22% asking for referral to a psychiatrist or a psychologist. Yun pong ating NCMH hotline is open 24/7. No? So baka yung ating mga kababayan na nangangailangan, you can call our NCMH hotline, yung usap po, every day or every time of the day na kinakailangan nyo makipag-usap. So bakit po tumataas? As we have seen or we have heard, 30% was due to anxiety and depressive symptoms, and the other 22% dahil sa pagpaparefer sa mga psychiatrists at psychologists. So ibig sabihin po, may mga pag-aalinlangan ng ating mga kababayan, meron ho tayong anxiety, may fear, and this may be linked to the increase in the number of cases nung mga nakaraang buwan. No? So baka sakaling iyan po ang ating mga rason kung bakit tumataas ang mga pagtawag sa ating hotlines.
Thank you for Yusek. Questions regarding the MV Athens Yusek from Vivian Gulia of ABS-CBN, Greg Gregorio of TV5, and Giselle Ricafort. So what is the Vivian Gula of ABS-CBN first. What is the effect if an individual gets less than the required COVID vaccine dose in terms of protection against COVID? Will they need to get the third dose?
Hindi ko naintindihan yung question. No? How will they get a less than the required COVID-19 vaccine dose?
Yusek, kunwari, nagpabakuna ako pero hindi na ako nag-second dose.
Okay, so yun ang tanong. No? So it's not really the less than required because if you are injected with the vaccine, it usually is maayos yung pagbigay sa'yo. No? So but anyway, kung hindi kayo kukuha ng second dose, you'll not get the maximum potential of the vaccine. Pag tinignan ho natin yung mga datos ng clinical trial, when you try to look at the results, you'd find, no, after the first dose, ito yung epekto ng bakuna, and after the second dose, ito yung epekto ng bakuna. So for example, yun pong isang vaccine A, sinabi niya na kapag ikaw ay nabakunahan ng first dose, you'll get, for example, 60% efficacy. Pero kapag nakuha mo yung second dose mo after the scheduled interval, you'll have almost 99% efficacy. So pag tinignan nyo, lahat ng bakuna, ganyan po, yung may mga second doses, tumataas yung efficacy na ibibigay sa inyong katawan kapag binigay na yung second dose nyo. So Ako po ay nakikiusap sa ating mga kababayan, dinggin niyo po yung sinasabi namin. Receiving one dose is not enough for your full protection against COVID-19. Get your second doses. Ito po ay libre. Ito po ay nasa mga implementing units or vaccination sites already.
Salamat po, Yusek. Regarding na sa MV Athens from Greg Gregorio of TV5 and Giselle Ricofort, ano po bang alam natin na regarding sa MV Athens? May we also get an update on the assistance that we're providing sa mga sakay ng MV Athens. Report says 12 of its Filipino crew tested positive with COVID-19 and 2 are in critical condition. Can we also confirm kung saan bansa galing ang MV Athens?
Ang MV Athens ay say cargo ship, no? So nakikipag-usap na po sila sa atin days before. They were trying to communicate already, no, with our Philippine Ports Authority regarding this matter. So when it comes to that, may I leave it to the PPA and the Department of Transportation ukol po dun sa mga detalye nitong cargo ship na to, saan siya galing at ano ang kanyang business and all. When it comes to the patients inside, we were given that report yesterday morning that there were 21 crew members. No, this is our initial report. So the numbers may change kapag po nag-validate na at nagbigay na ng full report ang Philippine Ports Authority at saka Bureau of Quarantine. But what we received, there were crew members inside the cargo ship and they were tested in their last stop, which was Vietnam. And dun sa pag-test sa kanila doon, ay 12 ang nag-turn positive. So among these 12 na nag-positive, 2 po ay may difficulty in breathing while on board the cargo ship. So they were coordinating with us and they were appealing, no, na ipadaong yung barko dahil kailangan ng tulong nung 2 crew member. So what we did, we accommodated, they were allowed to dock. And yun pong 2 severe, in-extract natin, dinala po natin sa isang ospital through the Bureau of Quarantine, sa isang ospital dito sa Maynila at sila po ngayon ay naka-confine na. As to the others who turned positive, these were 10, that's true. Yun din po ang binigay na report sa amin. Nag-assessment po tayo kagabi. Pumunta po doon ang ating Bureau of Quarantine officials. They were all checked, they were all tested. Nagbigay po tayo ng mga oxygen tanks also if in case over the night may mga ilangan. Pero ngayong umaga, nagdesisyon na po ang Bureau of Quarantine that we will transfer those identified to be positive sa isang quarantine facility here in Manila. And also, yun po mga na-expose na crew members, ika-quarantine na rin po natin. Lahat po sila ay itetest, lahat po sila na magpa-positive doon sa itest natin na second dito sa mga naiwan sa barko ay mag-whole genome sequence tayo. Pati po yung 2 pasyente sa ospital, nakakuha na po tayo double swabbing para ulitin ang RT-PCR at saka makapagpa-whole genome sequencing na rin.
Salamat po, Yusek. And because it's a Friday, we will go through all the questions we received in the chat box. Question po from Rafael Bosano. Question from Sherry Ann Torres of ABS-CBN. Nagrally health workers sa Espanya dahil hinarang sila papuntang Mendiola. After mag-dialogue with DOH last month regarding the unreleased benefits and allowances including performance-based bonus, mass hiring with permanent position nila at huwag silang i-red tag, ang sabi aayusin pero walang sinabing date. Hindi rin daw sinagot ng Malacanang ang pinadala nilang sulat appealing the same. Ano ang pwedeng i-assure ng DOH? Kailan talaga maibibigay ang hiling ng health workers? Yusek?
Well, as far as I am concerned and as far as I know, the hours after makausap ni Secretary Duque ang ating Alliance for Health Workers, ay nagkaroon na siya ng mga orders, especially to our Admin and Finance Office, no, headed by Yusek Bong Vega. Pinag-aralan na kung ano yung mga hindi na ibibigay, pinag-aralan na kung ano yung mga kakulangan din ng mga implementing hospitals natin para mabigyan sila ng pera. And immediately nag-download ng pera ang DOH para mabuo natin kung ano man yung mga pangangailangan ng ating mga healthcare workers. As to the other request of the Alliance, meron ho kasi mga request na kailangan pang kausapin namin ang Department of Budget and Management for additional funds. Kailangan namin kausapin ang DBM also para doon po sa sinasabing plantilla position ng nurses. So hindi po natin yan maibibigay kaagad-agad. Kailangan pa po namin makipag-usap sa iba't ibang ahensya po ng gobyerno. So sa madalit sabi, gusto lang po namin iparating sa ating mga kasamang healthcare workers, tinutugunan po ng DOH lahat po ng nasabi at napag-agrihan sa pulong with Secretary Duque. Yun lang po mga ibang bagay, it takes time, hindi po agad-agad magagawa dahil kailangan pa ho namin ng pakikipag-usap sa ibang ahensya ng gobyerno. But we would like to assure you that all of your concerns were found to be valid by the Department of Health at gagawa po kami ng paraan para maibigay po namin yung mga benepisyong kinakailangan ng ating mga healthcare workers.
Salamat, Yusek. Balikan ko lang yung kaninang tanong about the dosing. I think, Yusek, yung tanong nila on the required dose of COVID vaccine is because pwede kang mag-extract ng more than, di ba, dun sa AstraZeneca na vial. So parang yung tanong is, the DOH kasi has always been saying na wag na tong gawin because you risk underdosing. I think yun po yung tanong nila. Last March, DOH previously asked inoculators to stop the practice of giving less than the required dose of COVID-19 vaccines. But latest data show that practice still persists and is more widespread now with with 5 regions administering thousands of vaccines in excess of their allocation. How does the DOH plan to address this?
Well, we have already issued that advisory and we have instructed our vaccination units that we are not recommending, no? And we are strongly discouraging this kind of practice. Hindi po natin kailangang tipirin, no? Kasi yung iba siguro para mas dumami ang mabigyan, nag-extract sila ng additional from dun sa mga naiiwan dun sa vial. Huwag po natin gawin yan. Hindi pa ho natin na pag-aaralan kung ano ang pwedeng maging epekto sa ating mga kababayan. Yung katulad ng tinatanong ng media partners natin, nababawasan ba yung epekto? Kailangan pa ba magpa-booster? Wala ho tayong scientific evidence para sagutin yan sa ngayon. Pero ang laging sinasabi ng ating mga eksperto, katulad nga nung sinasabi nilang na naapektuhan na yung efficacy ng bakuna because of apparently some variants na wala pa rin naman talagang scientific proof or evidence, tuloy lang ang bakuna. Kung ano't ano man ang ibibigay sa atin ng bakuna na yan, epektibo pa rin yan. Ano? So kung sakaling kulang ang naging dose para sa'yo, dahil nga nagkakaroon ng 11th dose, no, dun sa mga vials for 10 doses, tuloy lang po ang second dose. No? At yun po ay magpo-confer pa rin naman ng ganung protection sa atin. Ano? And we will see in the future if there would be studies that can support these booster doses.
Salamat po. From Rafael Bosano, Dr. Salante suggested yesterday that the Philippine Genome Center may consider collaborating in training more whole genome sequencing. For whole genome sequencing. This is to be able to sequence more samples as it remains low. Does the DOH agree? Are we seeing the true picture of variants, whether VOC or VUI in the country?
That's the plan, Rafi. No? So kailangan namin, hindi namin gusto that it's just one office or one center which is doing all of this genome sequencing. Actually, we have 3 centers already capable of doing this. We have our ITM, we have UPNIH, and we have the Philippine Genome Center. So we would like to expand the capacity for this whole genome sequencing, not just here in Metro Manila, but also having strategic hubs in the other areas of the country. So kasama po yan sa aming plano. Kasama rin natin dun sa plano na of course initially mapagana na natin yung mga makina sa UPNIH at saka sa RITM para mas maraming gumagawa. And then eventually longer term ay magkaroon din tayo ng ganito mga institutions sa ibang bahagi ng ating bansa. As to yung kung enough, it's never enough. No? So gusto natin syempre lahat ng nagpo-positibo natetest natin pero hindi po ganun ang objective ng ating sinasagawa ngayon for whole genome sequencing. What we are doing is biosurveillance. Unang-unang question sa atin is detection. Malaman natin if this kind of variant or variant under investigation or concern is already present in the country. Pangalawa, malaman natin nasaan itong mga variant na ito. Pangatlo, malaman natin, are these variants causing the rise in cases, causing the clustering in cases, and causing the other things that are happening in this pandemic. So yun po yung tatlong initial natin na objectives ngayon for our whole genome sequencing. Longer term goal po ay malaman natin yung dominant variant, malaman po din natin kung ano-ano na talaga no, yung spread and yung ma-determine ano-ano na yung variants of concern and variants under investigation here. Pero yung first and foremost would be these three things that I've said.
We'll accommodate some more questions and then we'll ask you for your key message. Kailan po, no, from Catherine Gonzalez, kailan po ba magiging effective yung new protocol natin na test on the 7th day for arriving travelers?
Well, nag-ano na po tayo, no? Kahapon na ito ay naaprubahan ng IATF. So pagka nagkakaroon po tayo ng resolution from IATF, specific agencies concerned has to draft the necessary protocols. No? So kailangan pong i-draft yung protocol para maisagawa po natin at maumpisahan na ang pag-i-implement. Pero nagka-agree naman po lahat ng concerned agencies dyan na the soonest time possible ay maumpisahan natin ang ganitong protocol.
Okay. From Red Mendoza po, Russia has launched a new Sputnik Light vaccine, which is essentially the first dose of the Sputnik vaccine with a 76.4% efficacy. Pag nag-apply po ba sila dito, will they need a separate EUA or will a current EUA suffice?
No, it's a different EUA, no? So kahit nga yung production, halimbawa yung AstraZeneca, no? So kapag galing siya sa bansa na, for example, sa Korea, tapos may iba nang galing sa Thailand, iba-ibang EUA yan. Kasi pag tinignan ho natin yung Emergency Use Authority, very specific siya dun sa pumapasok sa ating bansa. So halimbawa, sinabi nung manufacturer, ang ipapasok ko ngayon ay AstraZeneca from Korea. Nandun ho sa EUA, pag binasa natin, very specific ang detalye niyan. Ilan, gano'n yan kadami, saan yan galing, and all. So pag may pumasok na bago uling Sputnik V and iba na yung pangalan, may Sputnik Light, kailangan po ng bagong EUA niyan.
Secretary Galvez said in an interview that we are eyeing to include 12 to 17-year-olds in our vaccination program. May we know what vaccines are we closely looking at for this sector of the population?
Laura, can you repeat? Mahina.
So ano po, si Secretary Charlie po, sinabi niya that we're eyeing to include the 12 to 17-year-olds in our vaccination program. May we know if there are already vaccines that we're closely looking at for this sector of the population?
Well, itong mga bakuna na ito, no, katulad nung sabi natin nung Wednesday, meron na pong pag-aaral na naisagawa na sa Estados Unidos kung saan yung pong mga bata 12 to 15 years old ay sinama na nila dun sa trial na sinagawa nila. And apparently, tapos na yung trial at nag-a-apply na sila ng US FDA, no, na approval. So kailangan nating antayin kung ano yung magiging resulta nito dun sa ibang bansa, and kailangan din po natin antayin na magbigay ng announcement yung specific manufacturer, and that's Pfizer actually. So kung sakali na meron na ho tayo mga ganitong experiences, resulta, and it will be recommended din ng, of course, WHO. Kung merong EUL yan, mas magaling din po. And then, susunod tayo dahil gusto ho natin mabakunahan as many of the sectors and age groups in the population. Sa ngayon, dun sa Estados Unidos, Pfizer po ang nagsagawa niyan, no? And titignan po natin kung magtutuloy-tuloy at makakuha sila ng approval.
Thank you, Yusek. For all your questions po, sagutin namin via Viber. Pero bago tayo magtapos, nais nating ipahatid na ngayong ito ng Mayo ay isang espesyal na araw dahil sa araw na ito ating ino-observe ang ating obserbasyon ng Health Workers Day, no. Sa ating patuloy na pagresponde sa COVID-19, malinaw na sa lahat ang pagiging bayani ng ating mga healthcare workers. Hindi maikakaila ang tapang at dedikasyon patuloy nilang pinapamala sa pagpapatupad ng kanilang tungkulin. At ang kanilang mga kamay ang isa sa mga dahilan kung bakit naiwasan natin ang tuluyang ang lunod ng ating mga ospital at pasilidad. Naway maging paalala ang araw na ito sa halaga ng serbisyong iginagawad ng ating mga healthcare worker at maging paalala sa ating lahat ng nararapat lamang sa araw-araw nating ipadama sa kanila ang pagkilala natin sa kanilang kahalagahan at ang kanilang hindi matatawarang tapak at walang kasing lalim na dedikasyon at pangangalaga sa kanilang kapwa. With that, we have a short AVP for our healthcare workers.
Laura, walang sound.
Natin kasangga sa pagtiyak ng kaligtasan ng ating mga kababayan. Tungo sa proteksyon ng buhay ng iba, malaya at buong tapang na ibinigay ng ating mga healthcare workers ang kanilang buhay. Kaya naman, tiniyak ng DOH na natutugunan ng karampatang suporta ang bawat kilos ng ating healthcare workers. Patuloy na tinitiyak ng DOH na may sapat na personal protective equipment ang ating mga frontliners, gayon din sa mga benepisyong nararapat nilang makuha. Itinuon ng DOH ang hawak naming pondo at kagamitan upang matulungan ang ating healthcare workers na maghahatid ng karampatang kalinga sa lahat ng nangangailangan. Ang mismong dedikasyon ng ating healthcare workers ang naging pundasyon ng ating laban sa COVID-19. Buhat nito, taus-puso ako nagpapasalamat sa lahat ng ating healthcare workers. Kayo ang mga bayaning muling nagbigay ng pag-asa sa ating bansa. Ang inyong tapat at buong pusong pagbigay ng serbisyo ang naging susi ng ating kakayahang pagalingin at protektahan ang ating mga kababayan. Kayo ang dahilan kung bakit naiwasan natin ang kumpletong pagbagsak ng ating mga komunidad, sistema at lipunan. Totoo ang yaman tao natin ang naging batayan ng husay ng ating pagresponde sa COVID-19. Dahil hindi magkakaroon ng epekto ang ginawa natin pagkilos upang dagdagan ang ating mga pasilidad kung walang kaakibat na dalubhasang mga ngasiwa sa mga ito. Para sa ating mga doktor, nurse, mga allied health workers at lahat ng kasama sa sektor ng kalusugan at siyensya. Naway, batid ninyo na ang ating kasalukuyang kinatatayuan ay nagmumula sa katatagan ng inyong mga kamay, lakas ng diwa at tapang ng puso. Marami tayong kwentong naitala sa ating paglaban sa pandemyang COVID-19. Ngunit ang kwento ng kabayanihan ng lahat ng healthcare workers ay may susulat sa kasaysayan bilang isa sa mga pinakamahalagang kwento ng ating bayan. Mabuhay ang lahat ng healthcare workers.
Ang kamay ng ating mga healthcare workers ang umaakay sa lahat ng Pilipinong nangangailangan ng tulong. At para dito, taus-pusong nagpapasalamat ang buong bansa. Maraming salamat po sa inyong lahat.
Sa lahat po ng ating mga healthcare workers, maraming salamat sa inyong dedikasyon at pangangalaga sa ating bayan. Mabuhay po kayong lahat.
Sa ating mga healthcare workers, mga doktor, mga nurses at saka hospital personnel, bukod sa inyong tapang at walang kasing lalim na inyong dedikasyon at tapat na pagserbisyo sa ating kapwa, ang nagsilbing ilaw sa ating laban sa COVID-19. Maraming salamat sa lahat ng healthcare workers para sa inyong pagmamahal at pangangalaga sa ating bansa at mabuhay po kayo. Kayo ang aming mga bayani.
My most heartfelt greetings to all our healthcare workers on the occasion of the Health Workers' Day. On behalf of a grateful nation, thank you for your strong commitment in helping the nation overcome the COVID-19 pandemic. Let me assure you that your government remains committed in protecting and supporting you as you continue to fulfill your duty as frontline during these trying times. To my fellow Filipinos, let us do our part to repay the hard work and sacrifices of our modern-day heroes by adhering to the health and safety standards and staying at home. Maraming salamat at saludo ang buong bansa sa inyong lahat.
Maraming salamat po. Yusek, for your final message today.
Salamat Laura, and maraming salamat po sa inyong lahat sa patuloy na pagsuporta at pagbibigay ng tama at saka verified na information. So kaisa po namin ang aming mga pinuno. Taus-puso po kaming nagpapasalamat sa ating mga healthcare workers at gayon din po ang buong Department of Health. Inaanyayahan po namin kayong makiisa po kayo sa buong bayan sa pagpapasalamat at pagbibigay pugay sa ating healthcare workers. Kung hindi po dahil sa kanilang serbisyo at saka dedikasyon, marahil po ay hindi na natin magagawang muling buksan ang ating mga pintuan at buksan ang daan tungo sa ating muling pagbangon. So maraming salamat po sa lahat ng ating healthcare workers. Saludo po kami sa inyo. Thank you very much.